We're going to take a look now at Merck, their price gouging on COVID therapeutics. This is in The Intercept. It's from Sharon Lerner. Merck sells federally financed COVID pill to U.S. for 40 times what it costs to make. The COVID-19 treatment, molnupiravir, was developed using funding from the National Institutes of Health and the Department of Defense. A 5-day course of that drug, the new medicine being hailed as a huge advance in the treatment of COVID-19, cost $17.74 to produce, according to a report issued last week by drug pricing experts at the Harvard School of Public Health and King's College Hospital in London. Merck is charging the U.S. government $712 for the same amount of medicine, or 40 times the price. Last Friday's announcement that the new medicine cut the risk of hospitalization among clinical trial participants with moderate or mild illness in half could have huge implications for the course of the coronavirus pandemic. Because it's a pill as opposed to monoclonal antibodies, a comparable antiviral treatment that is administered intravenously, whatever that drug is expected to be more widely used and hopefully will cut the death rate. In the first 29 days of the trial, no deaths were reported among the 585 patients who received the drug, while 8 of the people who received a placebo died, according to the statement put out by Merck and Ridgeback Biotherapeutics, the two companies that are jointly launching it. So the thing is here that this drug was developed using public money to finance the research and development. Now they're turning around and charging the U.S. government, which provided that public funding, 40 times the cost of production for the drug. And this is obviously a drug, you guys, that serves the public good, right? We want to attack COVID in as many ways as possible. I encourage people to get vaccinated if you haven't. We want to practice good, the social distancing and masking in situations where it's appropriate, this kind of thing. We also want to have good therapeutics when people end up in the hospital, right? Anything that's going to cut down on the death rate, cut down on the rate of major illness is a good thing. And can take some of the strain off of the healthcare system and healthcare workers, etc. So that their price gouging on this is, one of these instances of very predictable behavior, but quite egregious in this case. And even on an issue such as COVID that has so grasped the public attention for obvious reasons over the last couple of years, this isn't like, a lot of times when they're price gouging, it's on something that's behind the scenes enough that it doesn't draw a whole lot of attention. This is COVID, you guys. It's a COVID therapeutic. It's insane that this has flown under the radar in the manner that it has. And this is, I do want to note, this is one of the very strong reasons, one of the most prevalent reasons, I should say, that there is such vaccine hesitancy in this country is because Big Pharma behaves this way. Of course, they price gouge, they're rapacious, they're greedy. And why would someone trust them? And then when they go do this, they just kind of verify that account of their behavior and again, lessen trust in the vaccines and in other therapeutics and treatments. I do want to point out, though, to the anti-vax crowd that will drift to some other treatment, whether it's the ivermectin shit or whether it's these monoclonal antibodies, which are incredibly expensive, but apparently very effective at treating COVID. If you're willing to drift over to the monoclonal antibodies, it's like a couple grand per dose for those. It's insanely expensive. And who do you think makes those? If you're anti-vax because you don't want to give Pfizer and Moderna your money, who do you think makes the monoclonal antibodies? Who do you think makes ivermectin? Who do you think makes any of these other therapeutics or treatments for COVID? It's Big Pharma. If you're going to drift to the monoclonal antibodies, you're just giving more of your money to these companies than if you would get the vaccine. Okay, vaccine is free now; it's publicly paid for, but it's significantly cheaper in terms of production costs than the monoclonal antibodies. So again, if you want to oppose the vaccines, just understand that whatever treatment you're deferring to instead is also Big Pharma. So while I very much understand the institutional distrust that leads to some of this hesitancy, the sort of response that we see from people who still are hesitant about the vaccine is in many ways just entirely irrational. They're violating their own principle to try to grasp to this. I'm not going to go get the vaccine, right? So it's sad to see Big Pharma continuing to engage in this behavior, which contributes to that institutional distrust. It's also just flat out sad, like in a vacuum, to see Big Pharma continuing to price gouge for medications that people desperately need or that would improve their lives or make them less sick. That's all just egregious conduct, I think, in any ethical person or reasonable person's book. And it's a real shame that we allow it to happen so consistently and on such important drugs. Like the one that you see a lot of is insulin, right? There are a lot of diabetics that really desperately rely on insulin, and yet we gouge the shit out of it. I mean, or epinephrine is another one, with Joe Manchin's daughter famously price gouging on epinephrine, which people with allergies rely on to survive if they have an allergic reaction. I mean, this kind of behavior is capitalism at its core. We will choose profit and greed over your life, over your well-being, over your quality of life. And it's a real shame to see it continuing to occur here, even with COVID garnering obviously as much attention as it has. So shame on Merck and shame on Big Pharma in general for engaging in this kind of rapacious behavior and continuing to contribute to a distrust that then also has a negative effect on our ability to combat this virus. It's like in every way possible, they're making it worse. And of course, they get to benefit from making it worse, because if we don't pull out of this, and it's obviously an endemic at this point, they get to continue making the treatments and continue making the boosters and all this stuff, right? So I'm obviously not anti-vax. You guys, anyone who's a regular viewer will know that I got 2 shots of the Pfizer back in April, and I recommend that everybody get vaccinated. It's just a real shame that Big Pharma conducts themselves in a way that contributes to a lot of that distrust, right? So I do want to get here to